Hello everyone, today my article would be on pica behavior. The article is called Clinical Outcomes of Behavior Treatment for Pica in Children with Developmental Disability. The article tells us that pica is the ingestions of inedible or non-nutritious substance that lead to self-injurious behaviors or deadly behavior. Pica is frequently exhibited by individual who has intellectual or developmental disability. These consumptions include but not limited to paper, cloth, plastic, soap, rocks, cigarette butts, just to name a few. This can result to intestinal obstructions, choking, infections, and poisoning. The article suggests that the causes of pica comes from malnutrition, lack of environmental factors such as stimulations, sensory items or activities. It can also be from stressful events. It can also be from trauma-related events, abuse or neglect. Due to the potential life-threatening consequences of a single instance of pica, the treatment goal should be to eliminate the behavior rather than putting it on reduction. So the article tells us that there's very little article that I put emphasis on eliminating the behavior by putting it on extinction. Um, so this article is going to attempt to put this behavior on extinction by working with 11 individuals in a day program. The purpose of the article is to clarify the effects and the rate of success of behavior intervention for pica in examining data treatment for patients seen in an intensive day treatment program. So they use the keyword pica to retrieve and evaluate medical records on 11 individuals, 8 males, 3 females. Out of those 11 individuals, 10 had autism, 9 had intellectual disability. So these patients had a history of consuming wood, paper, metal, glass, sticks, leaves, dirt, paint, chips, Christmas ornament, nails, feces, batteries, and a lot of other things. Functional analysis is one of the methods that was used to identify any environmental consequences that was affecting the pica behavior. So the treatment based on functional analysis were effective because it provided a broad literature for treating other behaviors outside of just pica. Functional analysis evaluate the influence of environmental consequences that are likely to occur when an individual engaged in problem behaviors when they wasn't receiving attention or sensory item or preferred activity, or they simply wanted to escape certain demands or tasks. They also examine the rate in which the individual engaged in pica. So the baseline data was collected by excuse me. The baseline was simply collected by manipulating or baiting the individuals to engage in this pica behavior, but they used starch, seaweeds, dry beans, other things that resemble pica items to modify their functional analysis and to see how the individuals would engage in pica behavior in environmental consequences. They collected data that also engaged in pica as well as other problem behaviors using a software that was specific towards that. So the results shows that Numerous studies has demonstrated that pica can be significantly decreased with behavior intervention. Um, Only and simply on a well-controlled session. But what they couldn't determine was if it is able to expand into other environments rather than just a well control session. They concluded that behavior intervention are well established for pica for reducing it but not eliminating it. Results of this analysis demonstrate that behavior intervention can be highly effective at reducing pica to a rate almost to zero, but not completely. Pica was found to be maintained by an automatic reinforcement for all 10 of the individuals with whom a function analysis was conducted. But the good thing about this study was one of the individuals was able to be put on extinction. Future studies should also focus on taking steps to include the caregiver in the natural environment for the treatment. When I used to work in a residential home, I know that one of the issues we had was the individual constantly came up with a new way to do her pica. Like one time she used to put it in her pocket, the other time she used to put it underneath her bed, she used to put it in her closet and hide it in corners. So what we did was constantly had to search the individuals. She ate Lent, and we constantly had to search her and clean her room and find a way where she did not engage in the pica behavior. So my question to everyone would be, what made pica so challenging to eliminate or reduce? I wouldn't say reduce, but so challenging to eliminate by putting it on an extinction. What works best when dealing with pica behavior, and how can we stop it?